Hey guys, it's me, Dr. Smina Rahman, Gyno Girl. I just finished an appointment with Dr. Fenwa Millhouse, your favorite urologist on Instagram and YouTube, and I'm going to post the interview I did with her about stress urinary incontinence. There are tons of memes about it, and I did a reel about it on the day that I had the appointment as well. And there are tons of memes about people losing urine when they cough, sneeze, and laugh. And truthfully, it's... And I make jokes about it too, but it's really, a quality of life impairment. I joke about having to wear underwear that will absorb urine when I'm running or boxing or, whatever physical activities I'm doing. But it's something that needs to be addressed. It's quality of life. It's improvement of your quality of life. I'm going to share this video with you guys, and please like and subscribe to my channel. Let's get at it. Let's learn about stress urinary incontinence. Hi everyone, I'm Dr. Smina Rahman, Gyno Girl. I am so excited today to share the space today with Dr. Fenwa Millhouse, your favorite urologist. Yay!
Yay! I'm happy to be here with Dr. Rahman, and we are going to talk about what today?
Stress incontinence.
Yes!
I'm actually here in her beautiful new office. I'm so excited. I've been waiting a year to see her. I was like, when you open your new office, I'll be your first patient.
Yes.
But I guess I'm not her first patient, but maybe her first Bulkamid patient here at this location.
Yes.
So we're going to talk about that. But
correct. Yeah. And this is my office. I thank you so much because you really encouraged me. You being a practice owner yourself for almost a decade is goals. And so I've been open for 3 months now, so definitely somebody to look up to, and I can't wait to get into the stress incontinence discussion.
Oh, absolutely. I'm going to be full disclosure here and let you guys know that I have been struggling with stress incontinence since my third child. My baby's 4 years old. I'm obviously, I know what to do for it, right? I've done pelvic floor therapy after each child, and every time it got better, but I'm a big runner, and I box, and I do all this stuff physical activity-wise. And guess what's been my favorite friend? It's called the Speaks underwear, because I have to wear these underwear that helps to, absorb the
leakage.
The leakage, yes. And so basically, and I've tried a lot of things. I've tried after my third child, she's 4, like I said. So the first year or so, I did physical therapy. I did at-home devices. I have a lot of reps come to me saying that radio frequency, different devices work for incontinence, and I was like, okay, let me do it on myself, and if it works for me, I'll get your device, which none of them have worked for me, so I don't have those devices in my office, but I've tried many minimally invasive in-office procedures. And we know that the gold standard is the sling, but I'm going to let Dr. Millhouse tell you about that. Yeah. But I am very interested in a procedure called Bulkamid because I don't have the downtime to do the other procedure right now. Yeah. So I'm going to turn it over to Dr. Millhouse.
Thank you. Well, stress incontinence is an unintended loss of urine with activity. It is from a rise in pressure in the abdomen and pelvis that can be from a cough, a laugh, a sneeze, even just running, exercise, a jump. Sometimes it's as small as just bending over or certain position changes. That causes a rise in pressure.
And sex, too.
Sex can be a rise in pressure that is not supported by the urethra, and so therefore urine expels out. It's extremely common, especially in vulva owners, more than it is in penis owners, although it can happen in anybody. Other risk factors include pregnancy and delivery. Age is a big risk factor. So as we get older, we're worse or increased risk, and weight too, and physical activity. I have actually met young girls as young as 15, 16 who are avid long distance runners who have stress incontinence. So this is a very common problem, and it is a problem that, number one, there are no medications for this. If you have this problem and somebody is giving you a pill, take this pill for your stress incontinence, they do not know what they're doing. There is no medications for this. That is for the other type of incontinence, and that's a different video.
Urge incontinence,
where you can't hold it.
Gotta go.
Correct. Yeah. This is not that. Yeah. So What are the options for stress incontinence? Well, like my colleague has said, you can try physical therapy, Kegel exercises that can try to strengthen the pelvic floor muscles to recruit them to provide that hammock-like support under the urethra against that rise in pressure. Pelvic floor therapy, I love my pelvic floor therapist. It doesn't work for everybody. That's okay.
And I had to say it worked for me after my first 2 pregnancies. And my babies weren't that big. They're no more than 6 pounds. And, I didn't tear hugely. I had all vaginal deliveries. But I think that over the time and the years, the collagen and the the pressure and
yes.
And I'm very physically active. I run many marathons in the past. I don't do that anymore.
That'll do it.
But I can't. I always say I can't do a jumping jack to save my life, or jump rope,
because you'll leak.
I'll leak. Yeah.
Gotcha. Yeah. So a lot of factors there. You have the babies. You're getting older. You are very active. You run a ton. Lots of factors there. So what beyond physical therapy? Well, there are things we can stick in the vagina that kind of support the urethra like a speed bump. So there's something called Incontinence Pessary, which is essentially this medical grade plastic silicone coated device that acts as a speed bump underneath the urethra. We put it in the vagina in the office, usually the shape of like a ring with this knob on it. Ideally it fits comfortably, but you have to take it out periodically. You have to clean it, replace it. So maintenance is involved. There are incontinence tampons that are disposable that you can take and use daily. Beyond that, then we're talking surgical interventions, and surgery is a very common way to treat stress incontinence. I love stress incontinence because these are one of my favorite types of surgeries. And I basically break it down into 3 options. These are the 3 options that are used probably 99% of the time in the United States. There's some older, outdated procedures that we really don't do. So I'm not going to talk about that. But the most common procedure, and consider the gold standard, is a transvaginal midurethral sling. What the hell is that? That is a little tape of mesh that is placed under the urethra to support the urethra. This is done through the vagina, hence transvaginal. So it's a vaginal incision, and then this mesh is placed to support it like a hammock. Mesh has gotten a bad rap, but I will say this: transvaginal mesh is absolutely accepted and generally a low-risk procedure, and this is from the OGS, the Association of Urogynecologists Society, and SUFU, Society for I always forget this because it's changed, like urodynamics, female pelvic reconstruction, and urogenital reconstruction, something like that. I should know because I'm very involved in it, but it's so many words. Anyway, the societies that do all this, that have all the experts like us. Okay, very low side effects, mesh risk. Most people who have a transvaginal sling do very, very well. Success, I quote, is 85 to 90%. Actually, in my experience, there are very few patients I can remember where it did not work. I mean, it's well over 90% that patients are like, oh my God, it's significant. And it's so much fun seeing these patients in recovery or follow-up, because they're like, I can jump, I can run, I can pick up, I can do this. That is the sling. Now, the recovery is such that for 6 weeks, you're kind of out of commission. Nothing in the vagina, so no sex, no tongues, no toys, nothing, no fingers, no exercise. It's going to be
that's the
tough. Yep. Yeah. No exercise and no lifting over 10 pounds for 6 weeks.
Yeah. My 4-year-old's 35 pounds. That's the problem.
And he wants to get picked up. She wants to get picked up, sorry. Yes.
Yeah.
So there is something called an autologous sling. An autologous sling is basically the same concept as a mesh sling, but we're taking your own body. We're taking a piece of your body and making a sling out of it. We can take that piece either from your belly in a C-section type cut or from your thigh, your leg. I actually like taking it from the leg because it's just easier. And we make that into a sling and then we put that up. And that is also as successful as a mesh sling. The advantage is there's no mesh. Disadvantage is it is a more involved procedure. It's definitely a longer procedure. Yeah. Easily twice as long as, it takes me 30 minutes to do a mesh sling. Autologous sling can take me up to 2 hours. The recovery is a little bit more intense because the incisions are a lot bigger. Then the other option for surgery is Bulkamed, or urethral bulking. Bulkamed is a brand that is the most common urethral bulking agent, I believe, that is used currently, one that I use. But in general terms, urethral bulking. And urethral bulking, think of it like fillers. Fillers that people get in their cheeks or their lips to plump things up. We can use fillers. It's not the same fillers, but the concept is the same. We can use fillers to plump up the urethra and kind of provide resistance against urine leaking out. And that's the concept. It's done through a camera inside where you pee out of, so there are no incisions, none, which is great. It's quick, takes like 15 minutes or less to do. You're in and out. There is like virtually no downtime. You may have a catheter overnight. I would say less than 10% of patients of mine need a catheter overnight. And really you can return to full physical activity with 24 hours later. There's no restrictions like that. The Bulkamed, I've seen really good success rates that rival the sling, 85%. I will say this, however, the Bulkamed is unlikely to last as long as the sling probably will last you. And so there's no...
What is it, 18 months or something? Or the varies?
So about 40 to 50%. And this was not looking at Bulkamed specifically. This was looking at just general fillers. Yeah. At 1 year, about 40-something% of patients had started to recur.
Okay.
So, I tell patients, I think by between year 3 to 5, that most patients will probably, need either another bulking or do something different. But it's a great option. People love it.
I'm so excited.
Yeah.
The first 2 years that I, would suffer, like I'd go running and I'd have the underwear and it would smell. But it's my daughter. But now she's totally potty trained, so I can't even blame
your daughter.
I was like, my husband was like, oh, what's that urine smell? I'm like, oh, so
That's
but now I can't blame her because she's totally potty trained.
You can still blame her. Who knows? Okay. You just have to tell her to go along with it.
That's you, right?
But now she's getting fixed, okay, because you don't have to do that. You can get fixed, and I'm here to do it, so I'm super excited.
I'm so excited.
Yes.
Because we always talk about self-care, right? And I tell my patients this all the time. Like, you have to get out. You have to take care of yourself. If you don't take care of yourself, you can't take care of anyone else. And today, I'm actually going to live this advice, and I'm going to start taking care of myself health-wise because we have to. And, it's a quality of life issue, right? I mean, stress incontinence isn't killing me, but it doesn't make me feel good. And I box twice a week. I'd like to be able to jump rope and stuff, and I can't because I'm always like, you don't want me jumping rope, coach.
Yeah. I can't wait till you get back on that jump rope. Yes.
Quality of life matters. We all know that. I mean, she and I both treat things that do not kill women usually, but they will affect their quality of life, their sexual function, their urologic function, hormones and therapy related to that. And you have to know what your options are. And that's the whole point why I have full disclosure of what's going on, because I really want you guys to know what options are. And you can come see Dr. Millhouse in her new office for these procedures. So I'm very excited about this, and I will keep you guys posted on my success and my journey.
How cool. Okay. Well, this has been fun. Let's get to examine.
All right, guys. See you later.
Bye.
Bye. Take care.